talk about this 2024 state plan report. What is it made up of? How do you come to a finalization of this report, and what's in it?
Sure. So in 2021, the Arkansas legislature passed legislation that created an Alzheimer's and Dementia Advisory Council. And this council is comprised of several state agencies, but also many stakeholders, the Hospital Association, the Alzheimer's Association, and other agencies around the state who are working in the senior space, the UAMS Centers on Aging, and a variety of other stakeholders. And this council is tasked with making sure that Arkansas has an updated Alzheimer's state plan. We have to update that plan every 6 years. And then in the interim time, there is these interim reports that are due ahead of a legislative session, just to give the legislature an update on the status of implementation of the state plan, which is different in years past. Now that we have this legislative authority, not only will we have a state plan that's regularly updated, but also ensuring that it's not just a nice piece of paper, but there's active work going on and making sure the plan is implemented. So the Alzheimer's state plan is a state government plan that's intended to ensure that Arkansas is doing everything it can to address the Alzheimer's crisis, and that this issue stays top and center in front of the governor, but also the legislative body as well.
How does this plan then translate into the 2025 session? I would imagine that a lot of it has to do with funding.
Correct. So we submitted a list of recommendations in the state plan that are going to be turned into legislative action in the upcoming session. Some of the things are, of course, the recommendations identify some of the gaps in the state plan that have not been yet enacted. And so there were several recommendations that came front and center. One of them is to ensure that the Alzheimer's and Dementia Respite Grant Program, which has existed up to this point as a pilot, transitions into a more permanent plan here in Arkansas with additional funding. Currently, the state only funds this program at $200,000 annually. And so the ask is to make it more permanent and to try to keep pace with some of the other states who are funding similar programs. So, Kansas has a program similar to this that's funded at $650,000. So you can kind of see the gap. We only have $200,000 annually; they get $650,000. So we need more money to ensure that there's greater access to this grant program. Respite is critical for our caregivers, and as we go into National Caregiver Month, that's certainly top of center. Just making a move to ensure that our caregivers have the support that they need across the state.
And just to be clear, that grant money is used by caregivers to hire someone so they can get away for a while.
Yeah, respite's a great investment for the state. And we've argued that if you invest in respite services, families are then empowered to make decisions so that their loved one can age in place, which is their most preferred setting, right? And so if we invest in caregiver support, we can allow people to age in place longer and delay placement in more costly care settings. So it's certainly a fiscal conservative move, but it's also very, to your point, essential for dementia caregivers who need that respite break. Many of our caregivers also have children at the homes, and so they're caring for an aging parent, but also caring for a child in the house. So this gives them a time to take that respite to attend to other household duties. So in addition,
no, that's how much is public awareness part of this as well for next year?
So public awareness is huge. As you know, we are now in an era of treatments. The FDA has approved 2 treatments for Alzheimer's patients, but these treatments are only effective for people in the very early stages. So it's essential that public health establish a campaign and get more aggressive in spreading the word across the state about the importance of early detection and diagnosis of dementia, but also some of the steps that you can take to avoid or diminish your risk of developing dementia. We know that the research is clear. There's some things that we can do, that promotes our heart. What's good for the heart, we know, is good for the brain as well. And so we've given the health department several different steps they could take to get more active in the fight to raise more awareness about the importance, again, of early detection, diagnosis, and risk reduction. We would love to see the health department take more of an active role so that we can normalize the conversation around dementia in the same way that we've done that in the mental health space. Now it's kind of normal to have those conversations. There's still a stigma attached to our disease, and it's essential that public health uh, develop a campaign and a strategy to ensure that Arkansans, not only the residents, but also clinicians, know about the importance of early detection, diagnosis, and the opportunities and the coverage available for people to get those cognitive screenings.
Is there still a problem with accessing quality care, and does this plan for next year help with that?
Sure. So yeah, we continue to watch the dementia training standards across care settings. We know that nurse practitioners, many of those are they're filling service gaps in counties where there is not a primary care physician. And so have we made more steps in the state to expand the scope of practice for nurse practitioners? We want to make sure they have the latest training around dementia care, treatment, and also know the importance of early detection and diagnosis. So one of the steps we're looking at is trying to strengthen those dementia training standards, not only for nurse practitioners, but also looking at physician assistants, because we are realizing that those professionals are actually sometimes our patients' first touch. So it's essential that they have the training they need to know how important early detection diagnosis is, but also know the availability of treatments, because physicians have tools in their hands that 2 years ago they didn't have. And that's we actually have a treatment that can, treat the underlying biology of the disease. And so more awareness on the clinician's side is essential. But we continue to monitor that across care settings. One of the other recommendations that were put forth is just to ensure there's consumer protection in place. In the 2023 session, we took great steps to increase training standards in assisted living communities. And for those facilities who've chosen to have memory care or an Alzheimer's special care unit, we want to make sure they are adhering to the latest dementia training standards that are put forth in law. So we're looking at some consumer protection legislation as well, just to make sure people know that they, when they choose memory care, the staff is adequately trained to respond to the unique needs of the dementia population.
It's interesting that the access to quality care goes with, or kind of goes along with, the two medications that were approved for early stage diagnoses. This quality of care really pushes that diagnosis at an early stage, and so they go together.
They do, and early detection, to your point, is so essential. And what we are learning as we look at a program that's been in place since 2017 called during the annual wellness visit, you can actually receive a cognitive screening. What we're learning is physicians are not accessing the code, and many times patients have to self-advocate for that screen. So more needs to be done amongst physicians to spread awareness around the importance of this code, the availability of that screening, especially for the Medicare population. But also, we'd love to see that benefit extended to the Medicaid population, because what we know, Daren, is that Alzheimer's is not just a disease that for aging people, that people younger and younger are getting diagnosed. And so it's very essential that we get to these patients early so that they can, if they do qualify, they can receive treatments that will not cure the disease, but at least slow the progression of the disease to the extent they can still participate in their daily life. And it gives families the hope of more time, which is something they haven't had.
So you take this plan, what happens next now? You take this to the legislature next year, or this coming winter?
So the interim report has been submitted to the governor's office, and the House and the Senate leadership have a copy of the report. Now we have presented before committee. We presented before the House Aging Committee a couple weeks ago, just to share some of the outlines of the report and some of those recommendations. And this time of year, we're working more on bill development, making sure our bills are ready to go once the session gets here in early January. And we're just a few months away, so we are working really hard to make sure that we have agreement on language, and so that our advocates are ready to go come January 13th.
And that brings up our lawmakers starting to listen to this now?
That has been really encouraging. The association has recognized over the last 2 years, as the committee has been doing its work, more and more lawmakers who are not necessarily members of the council are attending these meetings. We've also had very good discussions with House and Senate leadership about some of our priorities. And what we are learning as we have conversations with lawmakers is that many of them feel it personally. They've either lost a family member or they are caring for someone who has a diagnosis. And so it's not a red or blue issue. It is certainly bipartisan. It touches everybody. And it's one thing that we often say that brings lawmakers together, where in other times it gets wrapped up in partisanship. But this is something that unites the country because it impacts all of us. But we are seeing more and more support, not only from the governor's office, but the House and Senate leadership as well. So we're really encouraged in the position that we're in right now as we go into the session. No bill is ever easy, but we do feel confident we have support.
Just for those who may not know, and they're caring for a loved one, or they know someone that's caring for a loved one, briefly explain how the association has their back when it comes to talking with the legislature.
Of course. So we know that this is a devastating disease that impacts at least over 60,000 Arkansans over the age of 65. The numbers are much greater than that, as you know, across the state. So we know this is a devastating disease that touches everybody, but we also want to know that no one should have to journey this disease alone, that we're here to walk with you, walk alongside you, to provide that 24-hour care and support services, just to help the families who are impacted by this disease. And so as we go into session, not only do we provide that care and support on a daily basis, but we also organize under the Alzheimer's Impact Movement, which is our 501c4, that allows us to work on legislation in ways that the nonprofit cannot. And so we have advocates and basically advocates, families, Arkansas families who have experienced this disease personally. We create opportunities for them to share their stories with lawmakers, because that's where the political power of the association rests. It's in those stories. They allow us to put a face to the facts and figures and the data that we're seeing in the state. And that's what lawmakers pay attention to. And for your listeners, we just want you to know that lawmakers really do care what you're going through. They want to understand. They want to hear from their constituents. They need to know what's impacting you, and they respond to that. And so we create opportunities for them to share their stories. And of course, on February 11th, we'll be having a state advocacy day at the Arkansas Capitol this year. So we certainly encourage you all to attend that. You'll see more information about that on our social media channels in the coming weeks when the registration goes live. But that's a great opportunity for you to get involved. And there's many other ways that you can get involved with us as well. If you have been touched by this personally, there's a place for you to advocate to help us move issues forward here in Arkansas.
David, appreciate your time, as always. Fantastic.
Always appreciate you as well. Thank you for covering this.